Welcome to our In Focus discussion tonight. New data from the Student Health and Risk Prevention Survey shows that the rates of underage alcohol use of LGBTQ plus youth in Utah County were twice as high as their peers. Tonight, we speak with 3 local organizations to learn a little bit more about what they do and how they've partnered up to address this issue head on. Kicking off our conversation tonight is Stephanie Larson, founder and CEO of Encircle. And Stephanie, thank you so much for being here tonight. We'd like to start with learning more about your organization. Can you tell us more about Encircle and the support you provide to LGBTQ plus community members and their families?
Sure, thanks for having me. Encircle is an LGBTQ resource center. We focus on youth, families, and the community. We provide life-affirming and life-saving services for LGBTQ youth across the state of Utah. We offer programs, therapy, support groups, educational materials, and our whole idea is to help families stay together and to help not only keep our LGBTQ youth alive, but to help them thrive.
And I understand you just opened your 3rd location. Is that right? You have one in Salt Lake, and help me out. Is the other one in Provo and one is in Ogden? Is that right?
Our first location was in Provo, then we opened in Salt Lake City, and we recently opened in St. George, and we're actually working on 5 new homes in Utah and 5 new homes in Nevada, Arizona, and Idaho.
Okay, I was kind of close. I was kind of close. Forgive me on that one. I knew that you all were expanding, and that's just such great news. Now, a study out of Utah County found that LGBTQ plus youth are at a higher risk for underage drinking. What are the contributing factors that led to this increased risk?
Well, we know that when a child comes from a family that is not affirming, they are 3 times more likely to turn to drugs, alcohol abuse, and other self-harming behaviors. I think that a lot of the kids who come to Encircle, they feel shame around who they are. They don't feel like their community or their family would love them as they are. And sometimes they turn to alcohol and drugs to numb that shame.
Yeah, it's kind of self-medication or perhaps a different outlet that they're not receiving at home. Now, how can parents approach that difficult conversation with their children if they may be LGBTQ plus and haven't opened up to them and may be suffering alone or finding an escape somewhere else?
Well, I think it's really important for parents who think their children might be LGBTQ or who just have children to send messages that they would love them if they did come out as LGBTQ. Maybe that's putting up a pride flag or talking positively about people who are LGBTQ, giving our kids a signal that they would be okay if that's who they are and they would still be loved and accepted in their family.
I almost feel like this work starts before that conversation, normalizing, right, the LGBTQ community, family, and friends as well. So, but great tips if you do come to that point in the conversation and not sure how to approach it. Stephanie, how important is it for parents to have an open, accepting, and supportive relationship with their children, and what kind of impact can that have?
Oh, I think it's extremely important. Something about us as humans, we need the love and acceptance of our parents, of our siblings, to make it on life's journey. And sometimes when that doesn't happen, it keeps these kids from progressing the way that they would have otherwise. It brings a lot of pain and hardship to their lives. Encircle works really hard to help families on their journeys because sometimes this is a surprise. We all have our dreams and our hopes of who our children are, and when it's not exactly that way, we need to adjust and we need to go on that journey with them and love and support them just as they are, and they will end up to be more thriving parts of our community.
Yeah, that support and open relationship can mean so much. Tell us about the mural that was unveiled this morning. What impact do you hope it has on the community, and what do you hope it accomplishes in the issue of underage drinking?
Well, I think sometimes as parents, when we're going through it, we're so close to it, it's hard to know what to do. And I think that this mural is a really great reminder to parents of, you know, what if I just hop on this journey with them? Maybe the ride's going to be a little bit more beautiful than I ever thought. It's different than I expected, but maybe, you know, what we'll see on that bike or on that journey will be even more beautiful than what I originally thought.
Well said. Stephanie, final words. What is your message to youth in our communities and their families about preventing underage drinking? Or where can our viewers go to learn more about Encircle and additional resources?
Well, you know, we do know that the brain is not fully developed until age 24. There is permanent damage that can be done if you drink too early. It's also more addictive the earlier you drink. And, you know, there are other ways to make it on our journey, you know, relying on friends and family. For LGBTQ youth and their families, we would love you to come to Encircle. You can find more out about our organization at encircletogether.org. We have therapy programs, support groups, and resources to help keep families together and to keep our youth safe and to help them thrive.
Yeah, I think the message that we're trying to drive home tonight is you are not alone. You've been hearing from Stephanie Larson, founder and CEO of Encircle. And Stephanie, we appreciate you for being part of this conversation. Thank you for being here tonight.
Thank you.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on LGBTQ plus youth and underage drinking. Joining us next live in studio is Heather Lewis, Substance Use Disorder Prevention Coordinator at Utah Valley Drug Prevention Coalition. And Heather, thank you so much for your time and welcome to the show. We'd like to start with learning more about your organization. Can you tell us more about the Utah Valley Drug Prevention Coalition and the resources that you provide to our community?
Absolutely, and thank you for having me. This is such an exciting moment for all of us. We've really been working hard to get to this point, so we really appreciate this opportunity to share our messages. But Utah Valley Drug Prevention Coalition is a community-wide coalition that brings community members together to focus on prevention issues that need to be addressed in our county. We do a needs assessment and we gather data to figure out where we have gaps in our services, where we are already providing services, and if we have gaps, then we address those. We look at what the needs are of our kids in our specific local areas, and we try to address those issues through our coalition work.
And your work is so important, so thank you for all you and your coalition do. Now we're taking a deeper look at the data coming out of Utah County, indicating that LGBTQ plus youth are at a higher risk for underage drinking. Can you tell us a little bit more about these numbers that we're seeing?
Yes, so in 2019, the Student Health and Risk Prevention Survey was released, and the data, for the first time, they had asked the questions about sexual preference and sexual identity and or gender preference and gender identity. And so we were able to gather data that we had never seen before. And we knew that there were some disparities happening in the communities, but we weren't sure until we saw the data what was really going on. And with 8th, 10th, and 12th graders across the board in all grades, the alcohol use rates within the last 30 days was at least double those of their peers.
Now we know that the most crucial step in addressing a communal issue or epidemic is the data collection, and so really glad to hear that we're finally adding more questions to identify how some of these communities are being affected. Now when people think of Utah County, they don't normally think that underage drinking would be a problem there, particularly because it's a more conservative area. What's your response to that?
Not in Utah County, right? It does happen in Utah County, unfortunately. We are fortunate to have low use rates compared to national rates, but we still have an issue in our county that we need to address. You know, one of the issues I think for our kids is that they are expected to achieve. They've got such high pressure and high demands on them that they really struggle if they can't quite meet that expectation. So I think that's one of the biggest factors. Peer pressure is another really big problem, depression, mental health issues. One other issue that we're struggling with is that kids don't feel connected to their schools, and COVID definitely didn't help that. So a lot of compounding issues that our kids are facing.
Sometimes we forget how hard it is to be a child or a teen. You're taking me back to some of the feelings that I felt, right, during my childhood, and I'm sure you felt some as well. Tell us about your partnership with Encircle and Parents Empowered. Why are these collaborations among community organizations so important in addressing this issue at hand?
That is such a great question. Because of the data that we found, we knew that we had to do something to address it. And Encircle was the only agency in all of Utah County that I was aware of who was working with the LGBTQ plus population. And so I reached out, and through some footwork and some really great people, Parents Empowered gave us a grant for funding for our messaging, and Encircle was all excited to jump on board with us, and so it's just been a great partnership from the beginning.
Yeah, I feel like there are so many layers when it comes to these different communities that we serve, and it just helps so much to have that partnership and to bounce ideas back and forth with each other. Now, are there red flags or signs of underage drinking that adults or parents can look out for?
I think a few of the things that parents might want to be aware of: dropping grades in school, missing school all of a sudden, isolation, depression, maybe even just the friends that they're hanging around with. If all of a sudden it's a new group that you parents aren't used to, that might be a red flag too. But we know our kids, and if your gut tells you something's off, trust it and ask questions.
Right, always kind of trust that instinct, right? Now, Heather, we're going to talk about steps and tips that parents can take in the next segment. We'll talk a little bit more about that, but what can we do on a community level to prevent underage drinking?
Get involved. Prevention is happening. Substance use prevention is happening. It's happening all across the state. There are people who are dedicated to this field, people who are excited to get these use rates down. We want to help these kids have better, brighter futures, free of, the dangers of underage drinking. And, so get involved, reach out. You can go to UtahValleyDPC.org is one of our coalition websites. You could go to the Division of Substance Abuse and Mental Health website. They'll be able to link you to coalitions all across the whole entire state. ParentsEmpowered.org is also another great resource.
Parenthood is a difficult part of your life to navigate, and you don't have to do it alone. You don't always have to be the expert. Thank you so much, Heather. You've been hearing from Heather Lewis, Substance Use Disorder Prevention Coordinator at Utah Valley Drug Prevention Coalition. And Heather, it was great to have you a part of this discussion. Thank you so much for participating.
Thanks for having me.
We'll be right back. Welcome to our third and final In Focus discussion tonight on LGBTQ plus youth and underage drinking. Rounding out our conversation live in studio is Heidi Peterson, a representative with Parents Empowered. And Heidi, thank you for being a part of this conversation tonight. We'd like to start with learning more about your organization. Can you tell us more about Parents Empowered and the resources that you all provide to the community?
Absolutely, and thank you so much for having us. And I want to throw out a huge thank you for the guests that we've already have. This partnership that we've talked about tonight is really kind of at the heart of what we do within Parents Empowered. Parents Empowered is a statewide initiative and campaign to eliminate underage drinking throughout our state. And our mission is kind of twofold. One is to educate parents on the harms that can happen when our kids drink underage. And the second is to provide skills to parents on how they can have this crucial conversation at home to prevent underage drinking. And the best way to do that is through these local partnerships. Heather talked about how local data really led them to this partnership with Encircle, which we are so excited about. So a big thanks to those partners.
It really takes a village, right? So Heidi, help us understand how harmful underage drinking can be. What can it do to a young person's brain, and how does it also play a role in the likelihood of future addiction?
Yeah, it's really nice. For a lot of years, maybe we had to do some guesswork when it came to underage drinking, but we have very clear research and science now that shows us as an adolescent's brain is developing, when alcohol is introduced to that environment in the brain, it can have immediate as well as long-lasting harms to the developing brain. Some of those harms include to learning, to memory, to impulse control, and like you indicated, that it can actually help wire their brain for addiction. We know, for example, that when a youth starts drinking under the age of 15, they are 4 times more likely to become addicted to that substance. So it's super important while those brains are developing, under construction, if you will, that they stay clear of alcohol.
And I think there's a science to it, why we restrict drinking until the age of 21. It's not just because we want to be sticklers, because there's a science behind that. Now, Heidi, where do youth get their supply of alcohol from, or where can they? I understand there's different places. And how do parents take an active, preventative role in that aspect as well?
Yeah, you know, there's a lot that parents can do, and if we were to poll parents and kids, and we do actually through that same survey that Heather mentioned, and ask them where do they get their alcohol, and a statistic that we'd really like to drive home to parents that may be watching at home tonight is that we know that 44% of kids actually get their alcohol from home with their parents' permission. Now, we know that this kind of happens because some parents feel like that, you know, maybe drinking is a rite of passage, and I'm going to go ahead and give my child permission because that way they're at least drinking at home, and maybe they feel like they're preventing that drinking and driving. And while that could be true, that they're preventing those car accidents from happening under the influence, there's really no safe way to drink underage, because whether they're at home or a party or anywhere else, their brains are still susceptible to that damage that that substance can provide.
Right, think of the brain development, right? And maybe like for a treat, like when your child turns 21, like, hey, I would love to have the first drink. I'd love to give you, as your parent, I'd love to give you your first drink. Like, there's other ways to still do the rite of passage, but not, you know, impact them on the level, in their brain and mentally and whatnot. Heidi, what could the long-term consequences be if we don't address this issue head on?
Yeah, again, I'll refer to some of that science that we have, and we know that there is a link when kids drink underage to low academic performance, to depression, anxiety, suicide, and to a host of other mental health challenges as well as behavioral issues. So again, a really key component to that, and you mentioned parents playing a crucial piece in that, is to set really clear rules that there should be no underage drinking. And that part about being really clear is super important. Sometimes as parents we think that we've set a rule, or maybe it's kind of a soft rule, and we think in that we're kind of being our child's friend. But when we look at the data on that, parents that have a soft no, or like, you know, I'd really rather you wouldn't, those kids have a much higher percentage of actually using. In fact, 37% still use, when it's a very firm no, that absolutely no underage drinking because I care about your brain development. I care about your journey and those dreams you have for the future. Only about 3% of those kids go on to drinking. So again, having a really clear rule, absolutely no underage drinking, can really be a great tool that parents can use.
That education and awareness can go a long way. So Heidi, what are the 3 steps that parents can take to prevent their children from underage drinking?
Yeah, 3 kind of pillars of Parents Empowered. Number 1, it's important to bond with our children. A good rule of thumb for bonding is to try to spend about 15 minutes a day in your child's world. Tune in, ask them questions about their day, about their friends, do things with them. Maybe it's the video game that they like to play, or the show that they like to watch. But what we know is when we are in our children's world, they're more likely to listen to us when we want to share something that's important to us. So bonding is critically important. The second one is back to that boundaries, to have very clear rules, absolutely no underage drinking, and to communicate the why about them. Help them understand the harms to the developing brain and why you're setting that very clear rule and standard for them. The last one that's also really important is to monitor. You know, ask our kids questions about where they're going, who their friends are, what activities they're involved in. And doing some of those follow-up questions, again, reiterates that we care about them, we're concerned about them, and can give us good information to help them navigate tricky situations in life, like staying away from alcohol.
Very good tips. Heidi, before we wrap, where can viewers go for more information and tips?
Yeah, we have everything we've talked about tonight. You can find more information on our website, parentsempowered.org.
Perfect. You've been hearing from Heidi Peterson, a representative with Parents Empowered, and I just want to mention Heidi knows what she's talking about. This is a personal cause to her. She's a parent of a child who is LGBTQ+. So Heidi, thank you so much for all of this helpful information. We appreciate your information and tips.
Thanks for having us.